Crandall has a master's in public health, and she is a force behind this team. And I say to my OR team, I'm nothing, and my husband even says that when I cook. He's like, you're nothing without your OR staff, you know? And it's a good excuse for why I don't cook so well. But this woman has really been an extraordinary influence on our team, and I'd love to have her come up and talk to us about the organization from the team of non-physicians on how this can be successful from the logistics.
Thank you. I have no financial disclosures. So what I'm going to be talking about is mainly what happens prior to the team or the surgeon landing on the ground and starting the work. And this is really good information for whether it's an individual going or a team going. You want to ask yourself some of these questions. What is my goal for this? Is it a goal for me? Is it a goal for me and my family? What's the reason behind me wanting to go and do this? And you want to also ask, what do I have to contribute to this team or to this clinic where I'm going to go work? And you also want...
Do you want to move back one?
No, we're going to go right to this. And then you also want to ask yourself, do I want to work domestically or internationally? Do I like staying in hotels, or does it not matter where I stay? I don't mind eating food that's unfamiliar to me, or I do. Either one is good or bad. They're just different questions you need to ask yourself honestly prior to deciding if you're going to be involved in an international outreach project. Once you've decided that and you're going to an international company, you need to begin your due diligence. You need to research the country and the clinic where you're going to be working. You need to look at the customs, the religions, the beliefs, the culture, what foods do they eat, what is their transportation system like, and say their water systems. And then you also need to ask, do I need a visa? Can I get one on arrival? And how long does that take? Because it's this pre-work that's really going to set you up for a successful get on the plane and go. And then also, do I need a medical license and how do I get one? And many places not only require a physician and a surgeon to have a medical license, but they require nurses, OR technicians, right down the line. And so you, again, need to do your research on who needs to be licensed to work into that country. And most of the answers to these questions can be found right on that country's Ministry of Health website. Again, more questions you need to research. Now you're looking at the clinic where you're going to be working. What is their electricity source? What is the equipment that they have or do not have? What supplies do they have access to, or the pharmacy that they have access to? And again, I go back to the quality of water. Will I need a translator? And if so, how many different languages and how many will I need? What will the transportation be like and the lodging? You need to look at the size of your team and then answer these questions. You can go forward. You need to keep that mental note that you are prepared and that you can handle anything, such as lunch, or we knew, you could go back one, we knew this is a clinic in South Sudan where we knew ahead of time we would be using solar energy, and that by the time the sun went down, we would only have a couple hours of electricity left, and our microscopes ate that up pretty fast. So we had to devise ways that we were going to get through the rest of the night, such as we took a pressure cooker, and we had one team member assigned to staying up all night, pressure cooking over an open flame, all of the instruments for the next day. So you can go forward. And then you begin gathering the documentation, and this is critical to getting in and out and back into your own country and for getting all of the supplies and equipment necessary. So your sponsoring organization needs to send you a letter of invitation on their letterhead. You need a letter of introduction from your organization at home, and that can include a certificate of donation, which would state, this is Julie Crandall, she's traveling with Moran Eye Center team. Everything she's carrying has been purchased or donated and will not be bartered or sold. Those two words are critical. Will not be bartered or sold. Otherwise, you're caught up in customs, paying taxes, having items confiscated, sitting in a quarantine for pharmacy, and then again, your project's done before you've even begun. So very important. The next thing you need to get, once you have these letters in hand, is then you need to request a letter of introduction from that particular Ministry of Health. And the more letters of introduction or invitation that you have from all the organizations you're sponsoring within country, the more likely you are to get a letter of invitation from the Ministry of Health prior to you going. This is the most critical letter to have when you're bringing a team and 40 bags of supplies and all the equipment into country, because this will go right to customs and move you through much quicker than not having it. And it's also good for the Ministry of Health and the U.S. Consulate to know that you're there, just in case of emergency. And then you can apply for your medical license. This is just a short list of everything required for every medical license we've ever had to apply for. And again, you need to include those letters of introduction, invitation, and it's especially helpful to have that Ministry of Health letter when you are applying for a medical license. And every Ministry of Health website has got a link to their medical licensing on that website, and it tells you the time frame and everything you're going to need. So that helps in your planning. Then you're going to need to plan to visit your travel clinic. The most important thing I can say about this is take home that yellow card and keep it with you everywhere you go when traveling. Because you show up at an airport, and if you can't show that you've had that yellow fever or whatever, they're going to take you behind a screen, and some airport worker is going to give you that injection. So it's important to always keep that yellow card with you and updated. Other documentation we require our team members to have are waivers of liability signed. We need emergency contact information. We have everyone sign a photo release because we use so many photos in our fundraising and otherwise. And then we outline every team member's responsibility so that they know ahead of time what they'll be doing once they get on ground. Now that you've done all this back work, you can start planning what you need to take. So because you've visited the country or spent a lot of time on the phone or internet with your sponsor, you know now how many examinations or screenings you're going to be doing, how many cases, what types of cases, what equipment they have, supplies they have, and pharmacy. And then this is one example of just a spreadsheet that lists everything you could ever need to do a clinic, an OR, and a post-op. And you just walk through that and write down how much of each thing you need depending on the number of examinations and cases you're going to do. This is the same thing with the pharmacy list. Everything we could possibly need that the clinic cannot provide, and we walk through, just write out the numbers. I have this mixture list up here to show a really important point. We tape this on the wall in the clinic where we're working. Before we leave, we visit with the pharmacist who's ordered all of our supplies, and he or she will walk through us and update us on how much you use of each item for an intracameral injection or for a retrobulbar or peri injection. We walk through each of those, make sure we're current, and then this is posted. Because when you're in a different setting, different tables, you're in a hallway, there are hundreds of people around you, or you have to switch jobs, you do not want a mistake made. And so this is current, everybody's doing the same thing, and it's this way for each position. Then you have all of this background information. Again, the next step is to start applying for grants or donations. Most of the ophthalmic companies have links on their website to apply for donations or grants. You have to use all of the paperwork you have acquired previously and include that list of supplies to apply for the donations. You can talk to your local rep. This person can also get you in touch with supplies that need to be donated. Go ahead. So now you're ready to travel. As we said, we pack everything in big duffel bags, and then we have big hard suitcases with cutout foam for any equipment that we need to carry. If we're taking tables, we use massage tables, and we just carry those as is and check them as luggage. But this is important for each member to have in hand prior to stepping on the plane. We put all of this information in a binder for each member of the team. They carry it with them. Their letter of introduction, in case they're separated from the team going through customs. I'm going to bump down to a copy of any purchases you're carrying in your duffel bags or any donation items you're carrying. Customs or Border Control want to see these. They want to know that you own this or that they've been donated, and that you will be taking everything out of that country when you leave. Again, otherwise you're in a lot of trouble with customs and you're wasting time. Go ahead. This is just an example of one of the forms we put in with our equipment. We own it. We're not going to sell it or barter it. It is fragile. It's medical equipment. We also include the manifests in with all of the equipment plus a receipt of that donation or purchase. Go ahead. And this is an example of one of the customs letters we write, just saying it's the Moran Eye Center, we own this phaco machine, here's the model number, here's the serial number, here's the receipt to that phaco machine. So all of this goes into every piece of equipment that we're carrying. So when your team lands and they see this and hundreds of other patients lining the hallways, waiting outside, you can just keep going, for you to come, every team member knows exactly what they need to do, where they need to go. Go ahead. So we know, because we've done our research ahead of time, we know exactly what the clinic looks like inside and out. Oftentimes we'll get measurements of the room. We've gone so far as to even tape that out on the floor of a room like this, so we know where we're setting up tables, where the microscopes will go, where the sterilizing will go, where patients will sit, and so forth. So everybody knows right where they need to go, and they can start prepping. So rooms like this, go ahead, rooms like this, keep going, and this, go ahead, we scrub everything down, floors, ceilings, keep going, move everything out, and then we move them piece by piece back in, wiping them all down, sterilizing as best we can to create an OR, to create an area for the retrobulbar injections. And we've also already know where we're going to do visions, where patients are going to wait, where we're going to do registration. Again, so every team member knows right what to do when they get there, so that your outcomes look like this, and like this. And go again. Thank you.